Hello, it is a pleasure to welcome you to the Catholic Health Initiative's educational session on human trafficking, Understanding a Complex Issue. I am Colleen Scanlon from Catholic Health Initiatives, and I would like to introduce our two speakers who have significant expertise in the area of human trafficking, Dr. Roy Ahn and Dr. Wendy Macias Konstantopoulos, both from Massachusetts General Hospital. Let me take a moment to explain why the issue of human trafficking is important to Catholic Health Initiatives. CHI has a long-standing commitment to violence prevention, which is rooted in the mission, vision, and values of the organization and our efforts to build healthy communities. It is an expression of the teachings of the Church and our common concern for persons who are most vulnerable. This commitment to violence prevention also reflects the works and the traditions of our participating congregations. CHI has formalized this commitment through a system-wide United Against Violence campaign and in the strategic plan. Violence is a public health issue, and it is preventable. We believe that working together across CHI, we can make a difference in preventing violence. So in partnerships with communities across this country, CHI ministries are addressing various forms of violence, including human trafficking. It is important that we better understand this complex and troubling reality. Hopefully, this educational session on human trafficking begins to do that.
Human trafficking is modern-day slavery. It is defined by international law as the act of recruiting, transporting, transferring, harboring, or receiving persons by means of threat, force, coercion, abduction, fraud, deception, or abuse of power for the purpose of sexual exploitation, forced labor, slavery or slave-like practices, or removal of an organ. The exception to this definition is in the case of persons under the age of 18, where the means used does not need to be proven in order to satisfy the definition of human trafficking. In other words, if a teenager is recruited for commercial sexual exploitation, that is sufficient, and there's no need to demonstrate the means used. Human trafficking is one of the world's most profitable criminal enterprises. Some estimates cite trafficking as a $32 billion a year global industry. The exact number of human trafficking victims around the world is unknown. Estimates are difficult due to the clandestine nature of this crime, the lack of centralized data collection systems, and the many barriers to disclosure faced by victims of trafficking. The International Labor Organization estimates that there are almost 21 million persons working under slave-like practices around the world today, though the estimate is likely low. By comparison, the combined population of the three most populous U.S. cities, New York City, Los Angeles, Chicago, is 14.9 million, which is 6 million less than the number of people trapped in forced labor around the world. The major forms of trafficking include forced labor, bonded labor, involuntary domestic servitude, sex trafficking, forced criminal activity, organ trafficking, and child trafficking. Cases of child trafficking have included the use of children for forced labor, domestic servitude, begging and peddling crews, sexual exploitation, child pornography, mail-order brides, illegal adoptions, and child soldiering. These are the faces of human trafficking, whether it is the factory worker, the forced prostitute, the child soldier. These are the faces.
The U.S. State Department's 2011 Trafficking in Persons report identified Thailand, Mexico, Haiti, the Philippines, India, Guatemala, and the Dominican Republic as the main source countries of origin for foreign-born nationals trafficked into the United States. It should be noted, though, that source countries, including the United States, are too numerous to mention. Data collected by the U.S. Human Trafficking Reporting System between 2008 and 2010 found that 83% of confirmed sex trafficking victims are U.S. citizens, while 95% of confirmed labor trafficking victims are foreign-born nationals, many of whom are lawfully in the United States. According to EGPAT USA, a non-governmental organization founded in 1990 and dedicated to ending all forms of child commercial sexual exploitation, the average age of entry into the commercial sex industry is 12, and both boys and girls are victimized. The Polaris Project is a well-known U.S.-based nonprofit, non-governmental organization founded in 2002 to combat and prevent human trafficking and slavery. It operates the National Human Trafficking Resource Center, which is funded by the U.S. Department of Health and Human Services and serves as the national hotline for human trafficking. According to data from the Polaris Project, calls made to this hotline come from across the United States. Every state is affected by human trafficking. Of the states that are home to Catholic Health Initiative's facilities, Texas and Colorado stand out in the sheer number of calls for help to the hotline. However, every state where CHI has a healthcare facility is touched by this horrific crime, and newspaper headlines abound. While this is merely a rudimentary proxy for the prevalence of human trafficking, these numbers underscore the existence of a significant problem. Well-recognized risk factors for human trafficking include a childhood history of sexual abuse, a dysfunctional family life, which may involve neglect, domestic violence, mental health disorders, parental drug use, or parental involvement in commercial sex. These factors may lead to home instability with adolescents either running away from or being thrown out of the home, or homelessness and the need to survive on the streets. Other risk factors include substance use, gang affiliation or membership, and vulnerabilities such as learning or physical disabilities and lack of financial security, such as a lack of income-generating opportunities. Risk factors present opportunities for prevention at various levels along the socio-ecological model of public health. They range from approaches that promote positive attitudes and behaviors in at-risk youth that reduce vulnerability, to broader societal efforts that encourage respect for human life and discourage violence and the exploitation of one person for another's profit. This power and control wheel from the Polaris Project describes the many tactics used by traffickers to manipulate and control labor and sex trafficking victims. These mechanisms of power and control range from threats, intimidation, and isolation to emotional abuse and sexual and physical violence. Human trafficking can result in significant health issues and needs. Physical injuries range from head trauma to bone fractures to bruising and cigarette burns. Sexual abuse may result in injury, sexually transmitted infections, and unplanned pregnancies. Other health problems may include malnutrition, psychosomatic symptoms such as chronic pain syndromes, dental disease and/or injury, substance abuse, and psychological disorders such as anxiety, post-traumatic stress disorder, depression, and suicidal ideation. In fact, even if a victim of trafficking suffers no physical or sexual abuse, the burden of emotional trauma is heavy. Human trafficking is a social ill that fuels violence and damages the health of individuals, communities, and society. Studies have shown that up to 50% of human trafficking victims are evaluated in a healthcare facility while being trafficked. Healthcare providers and hospital employees have a role to play in the fight against human trafficking. By remaining vigilant while going about their daily activities, healthcare providers, including doctors, nurses, social workers, physical therapists, and pre-hospital personnel, as well as hospital support staff, can help to identify and intervene on behalf of victims of human trafficking. There are multiple ways in which health professionals and other hospital personnel can become involved and help eradicate or mitigate the effects of human trafficking. They include education and training of healthcare professionals and their patients, more effective identification of victims, a robust referral network to a wide range of needed services, multidisciplinary collaboration on prevention strategies, research, advocacy, and public policy changes. We hope this brief introduction to this issue of human trafficking has been informative and increases your interest in better understanding and responding to the needs of vulnerable victims.
Thank you, Roy and Wendy, and all the people and organizations that made this educational presentation possible. We hope this program was helpful. Please visit CHI's web pages and work with us in preventing violence and human trafficking. Thank you.